Just because baby 7 is home now doesn't mean we have to stop learning every week from Dr. Ursini, and they have been so gracious to continue. So this is our third episode about laminitis.
Hi again, I'm Dr. Tina Ursini at the University of Tennessee, here for our third installment talking about laminitis. But what about the next 6 to 12 months of this horse? And I can tell you that that is the really tender time. We can get them usually through the acute flare or that initial stage, but what are we getting ourselves in for? First and foremost, you can expect shoeing changes, therapeutic shoes kind of reset, reassessments every 4 to 6 weeks. These shoes that we like, again with the foam, they do wear out depending on the environment that the horse is in. So these need reset a little bit more frequently than other options. The boots that we talked about last time, they need reset every day. So that's just kind of the first step of going forward. This is again our same horse with radiographs. So here we have the initial radiographs here on the right that show that acute rotation in the beginning, and then this is 6 weeks later. So you start to see this separation, which is what we would expect to see, but also this new growth. And so what happens, so first and foremost, we need to make sure that we're preventing any further insults to these feet, no matter the cause, so that we're not disrupting any of this new growth that's now matching. And if they have more rotation, it starts the whole process over. So that's why the first 6 to 12 months that it takes to regrow a foot are the most sensitive. Now you can imagine as there's lamina that pulls off, this tissue needs to remodel in here. It's really common for these horses to have abscesses as part of this process. So if we have an abscess or a pocket of fluid that's going to cause pain, then we're back into this support limb process, right? So now their one foot hurts, so they're going to overload the other one. We need to be really careful through that regard. And I will tell you that that is one of the harder things to manage as a clinician, is stopping that vicious cycle of abscess, overloading, and in all honesty, some of those horses we can't save through that process. So that is the first kind of tender moment to get through after the first flare. Usually happens somewhere in that 6 to 10 weeks after that first, again, initial flare. Going forward, again, we have to maintain and we have to control that underlying problem. So here, a lot of it is equine metabolic syndrome. We have to be all in on their diet. Cushing's disease, they have to stay on the medication to control the stress hormones. If it is support limb laminitis, we've got to make sure that that other leg stays maintained, and then we're supporting them as much as possible through that whole process. Let us know what questions you have. In the next one, we'll do kind of a Q&A and answer some of your specific questions. Again, thanks for listening. I'm Dr. Tina Ursini. The link is below for anybody who feels the need to donate to our project. Thanks.